All right, today we're diving into the world of celebrity eyelid surgery, and our subject is Anne Hathaway. So she recently appeared at the Ralph Lauren Fall 2025 show, and there was some chatter online about whether she's had plastic surgery. Now, we're not here to call anybody out, but my goal is to give kind of an analysis of what the eyelids look like and how they might change. It's up to you to decide if you think she's had anything done, and feel free to leave a comment below. So people are asking, did she or didn't she? Stay tuned to the end of this video if you'd like to find out. She was noted to be wearing a beautiful, elegant khaki outfit, and while I won't be able to comment on the fashion aspects of her wardrobe, since I am an oculofacial plastic surgeon, I can kind of guide us through an analysis of her eyelids so we can see what changes may have occurred. They may be related to photography, lighting, medicines, Botox, or different types of makeup, or possibly surgery. So keep watching if you want to kind of see the eyes through the lens of an eyelid expert. If you're new to our channel, I'm Dr. Kian Eftekhari, and I'm an oculofacial plastic surgeon. And if you'd like to see more videos like this, please hit the subscribe button. So Anne Hathaway has been open about the pressures to do plastic surgery. Back in 2008, in an article, she talked about how there is so much pressure in the world of Hollywood to do procedures around the face that can change your appearance. And she's always been known for a very elegant style. So I want to stop right here and say the point of this video is not to have a gotcha moment or to out anybody, but just to take a look at some static photographs from one year to another and try to identify features around the eyelids that can convey elements of youth, because you might not be able to do all the things that a celebrity can do to modify their own appearance, but there might be some simple tweakments or little things here and there that you can incorporate that might give your eyes more of a bright appearance and enhance some of the ways that you might look on the outside to match up with the way that you feel on the inside about yourself. All right, so let's dive into our analysis of Anne Hathaway's eyelids. So first, when we're looking at the upper face, there's kind of three different things that I take note of. I look at the brow, both the height, the shape, the contour of the brow, and how much volume is present there. I look at the skin on the upper eyelid and really how that skin transitions as it goes across. That's super important. And the third thing I look at is the eyelashes, because the contour of the eyelashes can tell you if somebody has one eyelid or both eyelids that are a little bit too low. And if the eyelashes don't have a nice arch to them, then that's an area where you can give a little bit more of an awake appearance to somebody by fixing the muscle that lifts the eyelids. That's called ptosis surgery, and that's an easy tweakment that you can consider for your eyelids if they feel heavy or droopy or just look kind of small in photos. In the lower eyelid area, there's kind of three things that I want to take a look at today that tell you a little bit about what might convey youth or beauty in the lower eyelids. First of all is the shadowing. So all of us, every single person has some shadows under their eyes. This can be masked by photography and by head positioning, but in reality, there is an area where the cheekbone is right behind the skin, and sometimes things can pooch out above the cheekbone to make it look dark down there, and sometimes there's just not enough volume below or on the cheekbone that can make it look a little bit hollow there. So shadows is one. The second thing I look at in the lower eyelids is how the eyelid transitions from medial to lateral as it goes across. A lot of people, it's kind of equal from the inner corner to the outer corner. It sits on an even plane. Some people, the outer corner is kind of pulled down a little bit, and you can see that gives you more of a maybe tired or aged appearance. And then in others, you can have more of an arching upward appearance to the corner of the eyelid. That's called the lateral canthal angle. And we're going to take a look at that in these photos. The third thing you want to look at in the lower eyelids is just the presence or absence of volume. That has a lot to do with the shadows I mentioned earlier, but we're specifically going to take a look at how that volume might appear when looked at in flash photography. Okay, so let's jump into her upper eyelids. First of all, you don't want to assume somebody has had surgery unless you can get really good photos with equal chin position. And that's hard because, as you can see in this 2025 photo, she's got a little bit of a chin down position looking up at the camera. And if you look at my eyes, there's a lot less you can see above the eyelashes when my chin is down. as opposed to when my chin is up, you can see more above the eyelashes. So when I take my standardized photographs in my clinic, I'm really critical about having the chin position be level because that tells you a lot about what's happening in the upper eyelids. Models especially, I've taken care of a few, have this tendency to adopt that chin down posture because it is something that is used in photo shoots. And you can see that that's adopted by Anne here in this 2025 photo. So comparing the upper lids and the eyebrows in the 2024 photo compared to the 2025 photo, we're going to take a look at three things. We're going to take a look at the brow shape. We're going to take a look at the lateral pretarsal show. So basically in the upper eyelids, between the lashes and that natural fold that many people have, there's a certain amount of eyelids showing, and in many cases, that gets lost by hooding as you go farther out. So the goal of upper eyelid surgery is really to help give a boost or give more of that upper eyelid showing as you go from inner to outer. And we're going to look at that. The third thing that I'm looking at is the distance between the peak of the brows, because that can change depending on if procedures have been done. Sometimes Botox can change the shape of the brows. Sometimes surgery, especially if things are kind of pulling up and in the way that many endoscopic brow lifts are done. Some surgeons kind of pull it out. Some surgeons like myself pull it in and up, almost like a clock hour has been turned. It can slightly narrow the distance between the peak of the eyebrows. So if we look at the 2024 photo, you can kind of see how as the eyebrows go across, they come to a natural peak, and then there's a little bit of a drop off after the peak. There's a little bit of asymmetry with the eyebrows where the right is maybe a touch higher than the left, but overall has a very nice brow shape. And then as it transitions out here, it kind of falls off, which is very common. The reason is you don't have any muscle out here in the temple to kind of lift the outer brow. In the 2025 photo, you lose a little bit of that drop off, and it looks as if the brow shape has gotten a little bit more at an angle where it kind of goes up like this. And after the brow peak, it doesn't necessarily fall off this way. It sort of just stays high, which I think is a very aesthetic and youthful appearance that we're kind of shooting for when you do an endoscopic brow lift procedure. The second thing in the upper eyelids is if you look at the 2024 photo and you follow the eyelid fold as it goes across from inner to outer, you can see that as you go past the halfway point, the skin starts to get closer and closer to the eyelashes out here. That's called lateral hooding. Now in the 2024 photo, you can see that she's actually looking straight on. She doesn't have much of a chin down posture. A chin down posture is going to narrow this distance even more. So if somebody has had an upper eyelid surgery, it's usually going to be even more apparent on a neutral chin position photo than one where your chin is down. It's actually going to be harder to see. The 2025 photo, you can see her chin is ever so slightly pointed downwards, and yet even though it's pointed down a little bit, you can actually see some of the pre-tarsal area, the area between the lashes and where that fold starts, be visible all the way across. It's pretty equal as you go across, a little bit different than the 2024 photo. Now that could be for a couple things. That might not have necessarily had anything to do with an upper eyelid surgery. If you pull the brows enough and get enough of a lift and a release on the brows, it can definitely make that area look more equal as you go across. That lateral pretarsal show looks more equal to medial pretarsal show in the 2025 photos. The third thing we look at with the upper eyelid area is the distance between the peaks of the brow. So this is a really hard thing to analyze on a photo because we don't have a ruler that can actually measure it. But sometimes I measure it in my office, and what we're looking at is to see if we've brought the arches just a little bit closer and higher, because that's going to give just a more lifted appearance. And the way I like to say it is the goal of an endoscopic brow lift is to kind of turn the outer part of the brow a half clock hour or a full clock hour up. We're not necessarily trying to lift like that because that just kind of can look odd sometimes, and it may not be necessary in many patients. So you can kind of appreciate how if you were to imagine her face and measure it, the arch to arch distance might be a little closer together than in the one that we saw in 2024. Now that could be from Botox sometimes if you intentionally spot someone's brows, which is unlikely in Hollywood because that's just something you generally don't want to do on purpose with Botox. But if you do, that could potentially pull those brows up while keeping this part stable so that it would narrow that area. In the lower eyelids, the three things we talked about are looking at shadows. So let's look at the shadows first. You can see in the 2024 photo that in the lower eyelid area, she has a pretty equal distance from the lashes to where that shadow or those little tiny creases start. And I think that one thing that's nice about these two photos is that the smile is pretty equal in both of them, because smiling can significantly change how the lower eyelids look and function, and it can accentuate some of the lines or shadows under the eyes. So you can see in the 2024 photo, there's a nice little shadow and line right there, and you've lost that a little bit in the 2025 photo. That shadow just doesn't seem as apparent, and in fact, that line has some asymmetry to it. So the one on the left is a little bit higher up, the one on the right is a little bit lower down, and that can kind of maybe tell you something, but it's hard to say. The other thing you want to look at with the lower eyelids is the lateral canthal angle. So in the 2024 photo, I think her eyelids go very gradually from inner to outer corner, slightly upwards, which is a very natural appearance of youth. If you adjust the canthal angle, and that can be done with a surgery at the corner of the eyelids or by moving the whole midface and temple itself, that can make it look like it's sort of swooping upwards at the outer corner, that tight look. And so, you can leave a comment below if you think that that's changed in between these two photos. The third thing you want to look at in the lower eyelids is the presence or absence of volume. And I think that when you look at the cheek area and you look at this area on the outer cheek, you really want to take note of, if you think about it like a balloon that's only been inflated a certain amount, which one looks like the balloon has a little bit more air in it. And that will tell you either that there's been potentially some addition of volume, like potentially fillers or fat, as we talked about. Sometimes makeup can give this appearance just depending on the lighting, so you can't assume just by looking at photos. The only other thing I would analyze here is that when we're talking about facial aesthetics, in general, you want to have a little bit more width and volume in these areas of the face, and a little bit more tightness and lack of volume in these areas of the face. And you can potentially see in the 2024 photo that there's a little bit more squareness coming to a point here, whereas in the 2025 photo, it does appear that there's more narrowing of this area in relation to this area. Now, that doesn't necessarily mean that somebody has had something done. It's not easy in these photos to look for something like an incision in front of the ear, which could be the sign of a facial procedure like a facelift. But interestingly, there are some types of facelifts done nowadays that don't involve an incision in front of the ear. Those have been popularized by surgeons like Dr. Kao and Dr. Mark Manny in Los Angeles. And Dr. Kao has even termed this surgery a ponytail lift because patients can wear a ponytail after surgery. That is the hairstyle she's rocking here. So just because there's nothing you can see here doesn't tell you, unfortunately, if somebody has had a facelift. And often the goal of that type of lift is more of an upward dialing of everything in the face, coming concentrically up towards here. I'll let you be the judge if you think that the face has more of that kind of concentric pulled upwards appearance in this 2025 photo. So while we may never know if any kind of surgery was done, now you have a little bit of an idea of how I analyze the eyelid area, both the upper and the lower eyelid area, and what features might contribute to a more youthful appearance. This might be able to be something that's accomplished with makeup or Botox or non-surgical procedures like lasers or fillers or fat transfer or surgical procedures that involve moving tissues around and removing tissues. If you'd like to learn more about eyelid surgery or see more videos like this, please consider subscribing to our channel or check out our website, eyelidcenterutah.com, and I hope you guys have enjoyed this video.